Hello, and welcome to Around the County. I'm Council Chair Todd Turner, your host. Thank you for joining me for this important and exciting conversation about healthcare. My guests are Board of Health Liaison, Dr. Terrence Fullum, and Interim President and CEO of the University of Maryland Capital Regional Health, Dr. Joseph Wright. Stay with us. Around the County comes your way in just a moment.
Without the letters A, B, and O, there's no mom. There's no Brittany. Because A's, B's, and O's determine your blood type. And we're missing all of them. Schedule your donation at redcrossblood.org.
Welcome to Around the County, a Prince George's County Council production. Take the journey, celebrate our communities, engage with us. We're working together to deliver service to our residents, to build thriving communities, and to make progress in Prince George's County. It's time now for Around the County, Service, Community, Progress, with your host, Council Chair Todd M. Turner.
Hello, and thank you for tuning in to Around the County. This is a program as a production of the Prince George's County Council. I'm your host, Council Chair Todd Turner. Access to quality health care, health promotion, and disease prevention are priority concerns for all Prince Georgians. The Board of Health and our healthcare partners are working together to shape health and human service policies that meet today's needs in Prince George's County. I'm delighted to introduce my first guest, Dr. Terrence Fullum, a physician, surgeon, and hospital executive at Howard University Hospital. Dr. Fullum is among the country's premier minimally invasive and bariatric academic surgeons. In addition to his academic and clinical appointments, Dr. Fullum is president and CEO of his own healthcare development and management company. He was named a super doc by the Washington Post. I'm proud also to introduce him as our Board of Health consultant and liaison. Welcome, Dr. Fullum, and we appreciate you joining us today on Around the County.
Thank you, Council Chair Turner. It's great to be here.
Thank you very much for your service so far as we're ending the legislative year for 2019. So tell us a little bit about Dr. Fullum and how you got to this point.
Well, first of all, it's an honor to be the health liaison for the County Council Board of Health. This year has been a great year. I am a Prince Georgian. I moved to the area August 1st, 1979 to attend medical school. I moved into Calvert Hall Apartments on 64th Avenue in Landover Hills. So been living in the area ever since, married here, raised children here, and also practiced here. Once I finished my training, I joined a private practice group originally and was in private practice in the DC metropolitan area, which included Prince George's County and worked at Prince George's Hospital, among others. This is a really very exciting time in healthcare, and particularly in healthcare in Prince George's County. As part of the Board of Health, I've had the opportunity to really review and evaluate several studies and we working together and collaborating with the health systems as well as with the county council allows us to really have the greatest opportunity to have a strong impact on improving health in the county.
Well, and I think that's one of the reasons you were one of those that we selected to serve as our Board of Health liaison. For those who aren't familiar with the Board of Health, that's one of our functions as the county council as part of that. And obviously you bring a wealth of experience both in practice and policy as well that helps us inform us about healthcare. So I know we literally just had our last Board of Health meeting earlier this week talking about some of the exciting things that are going on in Prince George's County with our healthcare system. Do you want to talk about those a little bit, what you see on the horizon
Sure.
as part of that, and then we'll get into our discussion about some of the work that we're doing with some of the studies that we're doing as well.
Okay. So we've had the opportunity to have some of the newer health systems that have come into the county come and report and talk about what their plans are, whether it's Luminous and Prince Doctors Hospital. Dr. Wright will be here from University of Maryland Capital Regional. Adventist Health Systems has recently acquired Fort Washington Hospital. They'll be coming into the area. And I think it's important when you have these health systems that there is collaboration, so you don't have duplication of services, you don't have wasted resources, and I know you're full aware of the importance of resources and the association between policy and resources and being able to affect change and improve the health in the county.
Great, I appreciate that. Yeah. So what is your goal as being our liaison to the Board of Health for your service?
Interpreter, I think is one. Help analyze the amount of data that we've received, where there's been several reports over the last few years that provide us certain information. What's really important is you look at the county council and Board of Health's health and all policies approach moving forward. So what are some of the determinants of health? And we recognize that the actual delivery of health care is just a small part of what affects the actual health of the community, that there are what we call social determinants of health that are important. So what we do in Parks and Recreation, and what we do in Health and Human Services, and what we do in the other buckets, if you will, of the policies and in the county are going to be very, very important. And so we have to sort of come up with a systems approach, if you will, service line, we like to say, on the healthcare side, so that we are efficient and we know where the dollar should go with regards to our policies, because policies direct resources, and if we put our resources in the right direction, then we'll get a positive effect on the outcome of the health of the county.
I know those were buzzwords that we heard earlier this week, healthcare in all policies, and obviously the social determinants of health, as you mentioned as well. Obviously, about 10 years ago, we engaged, the County Council engaged RAND in order to study some of the primary healthcare issues in Prince George's County. And as we indicated, this became the foundation of the conversation that led us to become part of the University of Maryland Medical System, and obviously the building of the new Capital Regional Health System. So it's been 10 years, and so we've come back as part of that process, engage RAND again. So tell us a little bit about this next go round, because I think it's more focused not so much on the primary healthcare system, since we've advanced, but more now what I would determine would be the social determinants of health, as well as some of the social service issues that we have.
I agree. So the county is prospering. Economically, we're doing very well. We're living longer, which is good, but there are certain areas that certainly have been identified that where there are opportunities for improvement. Just overall access, there are certain areas in the county where access is limited to behavioral health, access limited to some of the primary care. But what we're identifying is that access is also affected by the ability to have transportation. You know, can you get to the hospital? We're identifying that a lot of our primary care needs are satisfied in our emergency departments, which is very costly. Right. And so sort of changing that culture and having the opportunity for everyone in the county, when you talk about equity, is everyone in the county, regardless of their ability to pay, regardless of their ability to have insurance, whether they're insured or underinsured or uninsured, will they still have the same access to care when they need it? And so that's the sort of the 35,000-foot view, but we're recognizing that low-income families, the elderly, some of our immigrants don't have the equity, and so there are some opportunities there to improve that access.
So we re-engaged RAND earlier this year. I know they're in the process. We got an update as a part of our last Board of Health on some of the reasons and some of the facts and figures behind that. It's our expectation that we'll get that final report sometime early in 2020. Yeah. So what is your thoughts about how, I guess it's always the issue of implementing reports, that's always the harder part because it requires resource and
it does
as part of that.
Interpreting them and then putting together a strategic plan. One of the buzzwords I think is collaboration. And so when you look at all of the different policymakers and all of the council, everyone really will have a role to play. in the direction that we go. When you look at resources and you look at the budget, if you call it health and all policies, then it's going to change the way that we allocate the resources. And even when we allocate resources in different buckets, the direction of where those dollars go will also have an effect on improving healthcare, whether it's through a service line approach. Food deserts is one of the things that we talked about. There are certain areas of the county where we don't have easy access to foods, and there are new technologies where we can have food delivered. You can order food online now. Those kinds of things. Maybe some of that may need to be subsidized in the lower income areas. The reason why that's important is because, as an example, there's a direct correlation between what we eat and our health.
Gotcha.
Another one is building communities that are not necessarily so high density areas where there's a lot of traffic, so that you have the air pollution, because we know that affects the respiratory system. Making sure that we look for lead paint in some of our homes that are older, that were built before 1980, because that has an effect as well. Those are about three of the examples where it's not directly healthcare, but it's other services that we can provide improvements that, again, will indirectly affect healthcare over time.
I think one of my colleagues coined the term of co-opetition.
Yeah.
You call it collaboration as part of that between the different entities that serve Prince George's County, particularly our healthcare system. And I think one of the things, at least in our discussion with the University of Maryland medical system, was we just don't need a building, which is nice to have because we want to bring people back in to Prince George's County for their healthcare needs, but also kind of the primary care system itself within the county. So no matter where you are within the county, as part of that, you have access to the kind of healthcare that you are entitled to as a resident, I believe, of Prince George's County.
Yes.
As part of that. So, we don't live in a vacuum. Obviously, there's a lot of conversations going on about what's happening at the state and also at the federal level with respect to our healthcare system. How do you think we're impacted directly by those changes and new technology that's going on? Yeah,
I think that when there's competition, you have advancements in technologies, you have reduction in costs. So I think the fact that we have these healthcare systems that are coming into the county is very, very positive. The collaboration piece is going to be important to make sure that that happens. But one of the examples I used earlier was the opportunity to have access to healthy foods. Telemedicine is going to be important as well. We have some sensor technologies where we can identify kids that are getting ready to have asthma attacks earlier, and the doctors can be notified earlier, so that there's fewer trips to the ED, there are fewer admissions, and therefore the parents miss less work, right? And so that has a significant impact on the county from a resources, from a financial perspective, from an education perspective, as well as a health perspective.
Well, as we're wrapping up this segment, what would be your takeaway to the residents of Prince George's County about the future of healthcare services here in the county?
I would be excited. I think you're going to see some significant opportunities with regards to advancements in the delivery of healthcare, advancements in the access to healthcare. And I think that because of the health and all policies approach, we're going to be very strategic and very smart about how we go about doing it. So it's not just once I get sick, I go and see a doctor and the doctor takes care of me, but we're going to be doing some things that will improve your overall health so that you don't get sick, whether it's prenatal, family medicine, women's health, all the way to the other side where we have some advanced technologies with regards to the treatment of heart disease and cancer.
Right. Well, I appreciate it very much, Dr. Fullum, and please stay with us. It's time for a program break, but we'll return in a moment with our conversation about the new hospital coming to Prince George's County. My next guest will be Dr. Joseph L. Wright, Interim President and CEO of the new hospital. He joins me on Around the County right after this.
If you were born from 1945 to 1965, you'll want to listen to this. People born during these years are 5 times more likely to have hepatitis C. But many people living with hepatitis C don't know they're infected. You can live with the disease for decades without having any symptoms or feeling sick. Over time, hepatitis C can cause serious health problems, including liver cancer. A blood test is the only way to know if you have hepatitis C. Here's the good news. Hepatitis C can be cured. So, if you were born from 1945 to 1965, CDC recommends you get tested for hepatitis C because you still have a lot to look forward to.
Welcome back to Around the County, a production of the Prince George's County Council. I'm Council Chair Todd Turner, your host. With me now is Dr. Joseph L. Wright, recently appointed Interim President and Chief Executive Officer of the University of Maryland Capital Regional Health. A pediatrician and former Board of Health consultant, Dr. Wright has held academic, clinical, and leadership positions at Howard University Hospital, Children's National Health System, and George Washington University Hospital. He is also an adjunct professor of Health Services Administration at the University of Maryland School of Public Health. And he provides national leadership through advisory and governance service to several organized medicine bodies, and recently completed a term as an Obama administration appointee, and regularly provides expert testimony before Congress, the state, municipal legislative bodies, including us as the County Board of Health. He has also led the Board of Health members on a recent hard hat tour of the new hospital in construction in Largo. Thank you, Dr. Wright, for taking your time to join me on Around the County.
Thank you, Chair Turner. Pleasure to be here.
So how does it feel to be president of probably the largest health system in Prince George's County?
Well, this has been a long journey, as you well know, and it is a journey that has had many twists and turns, but it is a good feeling to be within now 18 months of moving into the new facility in Largo.
Right. So we know we just completed our hard hat tour. Appreciate that. It was nice to be up on the heliport and see the view up there, as well as what will be, I think, a shining star in Prince George's County as part of that. So how has been your experience in managing that process during your time as interim president?
Well, I've learned a lot more about construction than I ever thought I would, it's been a lot of moving parts, but something that I think has been very important for the county to see, the actual physical edifice. Those of you, anybody who's moved through Central County lately has seen not only the rise of the hospital, but also all of the development around the hospital, and certainly the 26-acre campus that is coming up is very exciting for the residents and our employees, my neighbors, and everyone in county.
So right now, it's as we heard earlier this week in the Board of Health, we were on time and on budget as part of that, and so it's a scheduled opening in April of 2021 at this point. Is that correct?
That's correct. April 2021 will be when the first patients enter. Between now and then, however, several important milestone dates. We will close out the skin of the building in January of 2020, so just a couple of months away. We'll actually be able to enclose the building, and then for the next year in 2020, we'll be fitting out the innards. That's right. my fancy construction terminology, and we will spend the first 4 months of 2021 training staff, making sure all the operations and everything is working before we bring the first patients over.
So obviously prior to this position, and obviously you were named interim, however before that you were named the Chief Medical Officer for Capital Regional Health as part of that, and left us as the Board of Health consultant, but we appreciate obviously your service to us. Tell us a little bit about what we expect to see with the new system. Obviously it not only includes the new hospital, you have the old Cheverly facility, and then other parts of that are also in Laurel, and obviously in my district at the Bowie Health Center as well. Tell us how that transformation will occur once the new hospital itself opens.
Yes, if I might just identify a point in time, which was September 1st of 2017, when the University of Maryland Medical System assumed operation of the three entities that in Cheverly, Laurel, and Bowie. And so what we can expect going forward is we've obviously talked about the new Capital Region Medical Center, the name of the new hospital, University of Maryland Capital Region Medical Center. But the system, University of Maryland Capital Region Health, also has campuses in Bowie, as you point out, and in Laurel. And if I might just say a little bit about Laurel, we are in the process of developing a health and wellness campus in Laurel that is also in the process of being constructed. That groundbreaking will take place in 2020 and should come online shortly after the hospital in Largo is up. And Bowie has been a long-standing freestanding emergency facility. We are building ambulatory practices in Bowie, have recently introduced plastic and reconstructive surgery, as well as ear, nose, and throat, and bariatric surgery there in Bowie. So there's a lot going on, but we're very pleased that the coordination of all of those campuses under one umbrella is coming together under Capital Region Health.
I appreciate that. And I know there was also some discussion about potentially additional office space in the southern part of the county as well. Why don't you explain what that is?
Yeah, so in addition to the activity on the three campuses I've already talked about, we plan to open ambulatory outpatient practices down at the National Harbor. A medical pavilion has been constructed there, and in early 2020 we will be establishing practices, specialty practices in neurology, but with a particular emphasis on headache, cardiology, general cardiology, as well as primary care. And critically important that we grow the primary care network in the county, and we believe that the southern part of the county is a place where there has been a dearth of those types of providers, and where we certainly can contribute to the access to care in that region.
Great. And then, so I know your predecessor, Dr. Fullum, talked about it. It's such an exciting time in Prince George's County, not only because of Capital Regional Health, but because of the other providers that are coming in. Can you share with us, as you did the other day, about what does that mean for Prince George's County, not only for Capital Regional Health, but for these other, because there is some collaboration, but there's also competition as part of that process.
Sure, and Chair Turner, the way I think about it, I'm a 30-year resident in Prince George's County, and yes, I'm sitting in the role as chief executive of one of the health systems, the major health system, the home team health system, if you will. But there is a significant disease burden in our county, and it's critically important that all of the systems that take care of our residents do collaborate, and that we don't have duplication of service and effort. And when I'm in my neighborhood in Upper Marlboro, the things that worry me is that the competition will obviate what we need to do in terms of service provision. I'd like to think about it as a rising tide floats all boats. If we are able to keep the health status of the residents of the county as the central focus, then everybody wins. The residents win, all of the healthcare systems win, and really that's sort of my vision and my hope as we move forward into this, what is a generational change for the county.
So curious about what you think our role as the county government should be. Obviously we've been partners. In essence, we're getting out of the hospital business as the county. We had that historic agreement in 2011 to bring the University of Maryland Medical System here. You've taken that over as of 2017. How can we, in essence, foster as the county government this collaboration or co-opetition that you think? Is there some overarching board that we might want to set up as part of that in order to make sure our partnerships are working together? I'm just curious from your perspective.
I think the county council, sitting as the Board of Health, has held the health systems' feet to the fire, all the health systems' feet to the fire about service provision, as specific the other day, talking about plans for behavioral health services, certainly an area of great need. And I think the County Council sits uniquely in a place to bring everybody together. I was sharing with you off camera that the Board of Health is the only forum where you have the ability to bring together all of the players at one time. We all can hear what's going on, and that's a very important forum. So I think continuing to do that work and continuing to emphasize those priorities is critical.
So what can the residents of Prince George's County expect with the opening of the new Capital Regional Hospital? Hopefully the improvements both at Laurel, Bowie, and in National Harbor, about the kind of services that they'll be able to get from the system?
Well, again, I think as you stated earlier, these are going to be in Laurel and in Largo, brand new facilities, state-of-the-art facilities, the highest level of technology that's available in our industry. But more importantly, you're going to get compassionate care. This is something that is very important to me as a leader, very important to me as a resident, very important to me as a father and husband in the community.
Right. So tell me, I guess, a little bit about some of the services that will be kind of maybe not new, but enhanced as part of being part of the University of Maryland medical system here.
Well, first let me say we will continue to be the mission-driven organization that we are today, provide a lot of what I call time-sensitive care, very timely care in terms of our cardiac services, our stroke services, trauma services. All of that is moving from Cheverly to Largo. So I just want to reassure everybody that that's coming. I think from the standpoint of customer friendliness, user friendliness, a lot of technology so that we can really meet patient needs. We really are focusing on the patient experience. That's something that the residents can expect when they come into the new hospital. And even before then, we are delighted to have folks come over and tour. We'll let you know when we open that up for the public,
Gotcha.
but very important for folks to see the campus.
So one of the things that obviously we have to deal with is, I think, a perception issue. I mean, the statistics say that a lot of residents go outside of the county in order to get their health care. And I think one of the focuses of bringing the University of Maryland medical system into the operation of our hospital system is to kind of change that perception, as you said, about the kind of quality of your patient experience utilizing the system. And having been someone who's used the system, particularly in Bowie Health Center as part of that, I've seen the change as part of that. So how do you address that perception?
Well, one very concrete change will be getting out of a 60-year-old facility that has had a lot of deferred maintenance. So there will be the physical transition. A lot of the perception is related to old physical plant. And then secondly, it's a branding issue. The name University of Maryland, Capital Region Health, will shed old names and move to a newly branded image. And then lastly, I think it's important to recognize the leadership. There is leadership and the physicians that we're bringing into the system as well. Right. Very important to have culturally competent physicians who concordance is key, being able to understand the community and align with the residents.
I appreciate that, and as we wrap up now, I just want to say thank you for your service, both to us as the County Council and the Board of Health capacity, and now in your capacity as the Interim CEO and President. And you know that you have our support as the University of Maryland Medical System makes a determination about who will be the permanent president for the Capital Regional Health as part of that. So with that, thank you again, Dr. Wright, and we want to thank both Dr. Wright and our Board of Health Liaison, Dr. Terrence Fullum, for the opportunity. Your service to our community means great progress for our county. This program, again, is a production of the Prince George's County Council. I want to thank our viewers for joining me throughout this legislative year of 2019. I want to take this opportunity to wish Prince Georgians a safe, healthy, and joyful holiday season. For council updates, please visit us online and stay connected through our social media opportunities. Again, I'm Todd Turner, Chair of the Prince George's County Council, and as always, I'll be seeing you around the county.
Thank you. year, millions of Americans use opioids to manage pain, and reliance on opioids has led to the worst drug crisis in American history. That's why the CDC recommends safer alternatives like physical therapy to manage pain. Physical therapists treat pain through movement, hands-on care, and patient education. No warning labels required. Pain is personal, but treating pain takes teamwork. When it comes to your health, you have a choice. Choose more movement and better health. Choose physical therapy.